a very important condition again, because with the present modern lifestyle, people sleeping less, people working more, people eating processed food, people not eating at the right time, people not doing relaxation exercise which relaxes their body and mind, like yoga and other meditations and other things. These are the people who develop hair loss or alopecia. As I said earlier, alopecia simply means hair loss. It does not mean any other specific kind of alopecia. So these are the various kinds of alopecias. This whole is alopecia areata on the left side, and it varies from different stages. The primary stage of alopecia, the mild transient alopecia areata, Ophiasis alopecia areata, and alopecia totalis or universalis. Sorry, where did this go? Yeah. So these are various kinds of alopecia areata itself. And out of these, these two are extremely difficult to treat, the Ophiasis and the alopecia totalis or universalis. This is somewhat difficult, but not so difficult. It can be treated. The average time span for these treatments is anywhere between 2 years to 5 years. But there can be a relief and a complete relief given to these patients. Other kind of alopecias are this is androgenic alopecia, the male patterned baldness and the female patterned baldness. They are because of the hormones. So, and the next is diffuse alopecia, scarring alopecia. In this condition, it is a permanent hair loss. Means the skin is scarred, and because of the scarring, the hair follicles are dead and there is no chance of hair growth to happen. So this is scarring. Trichotillomania is a habit generated alopecia, means a person develops a habit of pulling hairs by his own hand. So either it is the eyebrows or the hairs of the scalp, that they develop a habit, or it is an obsessive compulsive disorder where they go on pulling the hairs, doing something or when not doing something. And that is how they develop the hair loss. Scarring alopecia treatment, yes, homeopathic medicine can help the further progress, because scarring alopecia is a progressive disorder. Means if there is a scarring there in one part of the scalp, then this scarring can, if it is progressive, it can progress to the whole of the scalp. So with the medicine, the scarring can be stopped, but wherever the scarring has happened, there cannot be hair growth, because it is a complete, a total hair loss. Chemotherapy and hair loss, which we all know, it happens when during the cancer treatment. Traction alopecia is when the hairs are tied very hard, very tight, with pulling the hair from the front, and that causes alopecia. It is a treatable condition. TE and CTE, telogen effluvium and chronic telogen effluvium. People who have sudden stress, sudden anxiety, sudden shock, people who suddenly lose weight with whatever diet plans or whatever exercise they do, they can develop this hair loss, which is called telogen effluvium. And if this thing is chronically done, then they go into a chronic telogen effluvium condition. If it is in acute telogen effluvium, it is very easy to treat. Chronic, as it goes, it becomes more and more difficult to treat. Side effects of chemical beauty treatments like hair coloring, hair perming, straightening, softening, etc. All these are also responsible for hair loss, and they have to be treated accordingly. So these are various hair conditions that you may come across. Now let us see something about them. Hair loss, also a support center of Dr. Rohit, who gives external Ayurvedic treatment. So with people who have totalis or universalis, We treat them with Ayurvedic and with homeopathic, both together. Dr. Rohit treats external treatment, like he gives oils and herbal paste to apply on the scalp, and I give homeopathic medicine. Alopecia areata is primarily an autoimmune disease. So when they start with homeopathic treatment, the success is exemplified. Like I see Universalis or Totalis patients start growing hair in 4 to 6 months. For they must have had they must be into this condition for so many years. But as soon as they start these therapies, the hair start growing in the body, which is very encouraging. And you'll see some of the case pictures that I will show towards the end of these slides of alopecia. And it is astonishing, right from a 2-year-old baby who lost all her hairs on the whole body. In another 6, 8 months, you find the hairs very well, and you will not even imagine that this girl had got into this universalis hair loss pattern. So it's very interesting. Initially, I used to think that it is not possible, but ever since I have been treating these patients successfully, I am very much optimistic about. If patients they stick to homeopathy, if they stick to the instructions that I give them, and then the chances of their hair growth is great. Unless if they have scarring, unless if they have developed scarring, then there is no choice. Male pattern and female pattern baldness are usually permanent hair loss. These are conditions in which you can stop the progress of the loss. Wherever loss has occurred, the hairs don't grow back. My experience is hairs don't grow back. You have to go for other treatments like hair transplant or something. The patients have to come fairly early in life, or early in life means early uh, in the process of the disease when it has started. Then you have to come. But usually what happens with male and female pattern baldness patients come fairly late. Like they have already had a receded hairline, and the hairs, when we examine the patient, we find the hairs on the top of the head are very thin because of the androgenic effect. The hairs have become thin and the follicles are gradually dying out. Now, when the follicles have died out, it is very difficult to revive them and to make them grow hair. So, and there is no test in medical science up till now which can tell you whether a hair follicle is alive or dead. It is examination which will tell you whether it is alive or dead. And these are the hairs which never go away. The sides of these are called fetal hairs. So mostly in most of the males, they don't go away even until their death, whatever age it is. These hairs, they remain. But the hairs above this, they usually go away. So if patients come early in their life of starting of this illness, then there are chances that you can stimulate the hair follicles to grow more hair. But wherever you see, when there is a shiny skin like this developed, there the hairs don't grow. No chance. Very, very rarely, once in maybe 1,000 patients, I may have seen that the patient had gone into male pattern baldness and again he started growing hairs. But as I see, this is a very rare occurrence. But in women, it is quite interesting because women, though they have developed this female pattern baldness, if they take treatment, I have seen women to have at least 20 to 30% improvement in the density of the hairs. But in males, I haven't seen much. But that is my experience. It can be different with others. Okay. Anyone can lose hair on their head, but it is more common in men. People typically lose 50 to 100 hairs a day, This usually is not noticeable because new hair is growing in at the same time. And this is the reason why patients don't come to us. They are losing hair, but they don't see the thickness of their hairs receding. And that is why they are not aware about that they will eventually go into that process of an extensive hair loss. And all of a sudden, one day in the morning, they will look themselves in the mirror and then get anxious about and worried about it. So hair loss occurs when new hair do not replace the hair that has fallen out. Signs and symptoms of hair loss may include gradual thinning on the top, like you find with the androgenic alopecia in the women. It is frontal fibrosing alopecia. Circular or patchy bald spots on the skull, like we saw with alopecia areata. On the beard, when these bald spots happen, it is called alopecia barbi. Sudden losing of hair, the telogen effluvium, a physical or emotional shock can cause hair to loosen. Handfuls of hair may come out when combing or washing hair or even after gentle tucking. This type of hair loss usually causes overall hair thinning but is temporary, the telogen effluvium. But when it goes into chronic, then it is CTE. Some conditions and medical treatments, such as chemotherapy for cancer, can result in hair loss, which we saw in the diagram. Patches of scaling that spreads over the scalp, this is a sign of ringworm. So this is a disease of the scalp, the skin, not the hair. But it can result into accompanied by broken hair, redness, swelling, and at times discharge. Causes of hair loss, family history, it is heredity in nature. Androgenic alopecia, male pattern, female pattern. Hormonal changes and medical conditions like pregnancy, childbirth, menopause, thyroid can affect the hairs. Alopecia areata is an autoimmune disease. Hair loss can be side effects of certain drugs such as those used for cancer, arthritis, depression, heart problems, gout, high blood pressure. It can be due to aging. Radiation therapy to the head is responsible. Stress after a physical or emotional shock. Hairstyles and treatments, pigtails or cornrows that we saw in traction alopecia and others. Significant or sudden weight loss. Poor nutrition is also responsible. So these are the causes which can be responsible. There are many more, but these are the most common ones that we see. Even like I said in the beginning, if you don't sleep proper hours, if you don't eat at proper time, if you eat more of processed food, then your body goes into a particular dysrhythm and loses its normal biological rhythm. And that is where it produces stress on the systems like the immune system and other systems. And the stress on these systems can eventually result into hair loss. This was a case of alopecia areata, where this girl, you see these hairs which are more wavy, these are the hairs which are recently grown from this spot, while the other hairs are more straight. So these wavy hairs, when they mature, they will turn out to be regular hairs. This is the picture of a lady around 40, 45 years. She came to me with this particular type of hair loss on the scalp, and with treatment. And this is the latest, August 2023. I haven't seen her after that, but the hair is growing in a positive direction. So it is good. She'll probably have to take treatment for 1 or 2 more years. This is the case of a girl around 2 or 3 years of age who came to me with complete universalis. Like you see, the eyebrows also not there. And this was in May. And then in October, you find some hair strands coming. And this was February that you see hairs coming. Even the eyebrows are seen here. And this is July, even last November, or I saw her yesterday, Saturday, and she has more hair growth than what this is. So right from Universalis, no hair growth on the whole body to you see the eyelashes, the eyebrows also developed. She still has a small round patch on the back of the head at the base on the cervical or occipital area, but that will gradually grow back. It will take time, but it will grow back. This is again, this probably I'll show you the details of the case. A girl around what age? Again, same, seventh, eighth standard. So maybe 12 or 13 years. She came with Totalis, but few hairs on the eyebrows, eyelashes, few hairs still remaining. Before treatment, after treatment, everything very well grown. Now I don't see her, most probably because she is fine, does not have a problem.